All right, welcome everyone. Thanks for joining us today, Wednesday for Gentle Movement at Home. It's great that you've made the time to join us today. I'm seeing a few familiar names in the list, so welcome to those people starting to recognize some names. So I see Anna and Lori and Trish and Zainabu, along with some new folks and some other names. So thanks so much for coming. It's nice to see you all again. We're going to get started in just a moment. My name's Jen Hansen. As many of you know, I work at PNBC, and today we're joined by a guest instructor, Allison Ezzat. And we want to say a big welcome to Allison. So Allison is a physiotherapist who works at North Shore Sports Medicine. She is very experienced in the area of chronic pain. She regularly teaches functional movement to people with osteoarthritis through the GLAD Canada program. She also is a researcher out at UBC, and so we're really lucky to have her join us today for our program. Allison is going to be doing a combination of standing, sitting, and lying down movements. All you need is a chair, and if you want to lie on a yoga mat or something, that would be great, but you don't need it. What else can I tell you about today? As you know, we're recording this session. It's on Facebook Live, and you can find the video afterwards there or on our YouTube channel. We'll be doing a poll at the end so we can see what you thought of the session. And if you need any help, just talk to me or any of my colleagues in the chat. You can put questions for Allison in the Q&A, and we'll take some time at the end to read them, and she'll be able to respond. So if you have questions about any of the postures or the movements, or just in general, something you were curious about pertaining to the session, we can talk about that then. We're not going to be giving specific medical advice. That's really important to know, but we will have some time at the end to discuss it. Our next session is tomorrow back again with Neil Pearson, tomorrow at 1. And then next week, we've got 2 sessions, both on Tuesday and Thursday, both with Neil. And I just want to remind everybody about our peer support and wellness groups, which are now running online. We had one on Tuesday, yesterday, and we've got another one coming up in 2 weeks. We also have the pain support line for anyone that needs a little bit of assistance during this time, and you can always go to our website and find more help. All right, I'm going to stop my slideshow, and we'll turn it over to Allison.
Great. Hey, I'm just gonna fix one thing here too with there we go. Okay. Well, hello, thank you for the introduction there, Jen. And thank you for those of you making the time to join me today for this class. As Jen already gave a really nice introduction, I'll just say again, I'm a physiotherapist. I've been a physiotherapist for 15 years. Working clinically, and recently completed my PhD looking at the prevention of knee injury and then prevention of osteoarthritis and management of osteoarthritis after joint injury. So again, as Jen mentioned, my background is in teaching functional movement classes for people with hip and knee osteoarthritis through the GLAD Canada program. And so just before we get started today, I just want to remind people that it's really important that everybody go at your own pace, and please feel free to take breaks as you need them. Feel free to modify any exercises, whether that's doing less repetitions than I show you. I'm going to also try to show a variety of levels for the exercises. And of course, for any exercise, there's always the option to take a break, and even just to visualize yourself doing that movement can also provide benefit. So obviously I can't see you as you're going, so this is very different for me compared to what I'm used to when I'm teaching my regular class. So we just have to trust that you're going to be checking in with yourself as you go. And, you know, don't forget to pay attention to your breath as you're going. Pay attention to if you have any body tension, where your thoughts are going, where your emotions are going. So I'll be reminding us of this as we go through the class. So again, one more thing before we start is I'd like everyone just to really check in with yourself and give yourself a rating on a scale of 0 to 10 of how you're feeling right now as an overall rating of your pain. And we're gonna sort of come back to that throughout the class, and I'm gonna talk about it at the end. And this is something that we use quite a lot in the GLAD program in people with hip and knee osteoarthritis, and just trying to be aware of how we're feeling as we're doing the exercises. So the first thing we're going to start with, just sitting in the chair, or if you're not comfortable in the chair, you could be sitting on the ground, or you could even be standing up at this point, is we're going to go through the body, starting with our feet and moving up through the top of our head, and just what's called a body scan of bringing awareness to various parts of our body. So just to bring yourself into a comfortable position, feel free to close your eyes if you'd like to. So first, I just want everyone to think about the position of their feet and feel your toes on the ground, maybe give them a little bit of a wiggle. Feel the weight going through the outside of your feet, right through to your heels and the inside. You can maybe kind of lift up your toes a little bit, just lift up your heels a little bit and then put them back down. Pay attention to how that feels. Okay. And then next, we're going to go up to your ankles a little bit higher. So think about the outside of your ankles. How does that area feel? And then moving to the inside as well. Maybe think of sort of a circular motion, as if someone was drawing a circle around the circumference of your ankle. Okay, now we're going to move up to the leg a little bit. We're going to move up through the front of the shin area. So feel that front of the leg. And again, just acknowledge how it's feeling, pay attention, and then relax. We're also going to feel the back of the legs now. How does that feel? If you raise up one foot a little bit and then put it back down, that's just going to get those calf muscles turning on and engaging. So you can just lift up one side and then the other. Good. Okay, so now we're going to move to our knee area here. So again, thinking about your knees, you might be able to feel them, feel the backs of your knees on your chair, depending on how you're sitting. Feel the front. You might feel a little bit of space between your knees. They might be together, they might be apart. Again, just bringing awareness to that part of your body. Okay, now we're going to move up to the thighs. So you might have your hands resting on your thighs like I do. Just bring awareness to the front of your thighs and how that area feels. You can move around to the outer part of your thighs, back of your thighs, and see how that feels as it's resting against the chair. Great. Good, and just pay attention again to your breath for a few seconds. Are you holding any tension? Are you tensing through your neck or your shoulders? You can always give your shoulders a little bit of a roll. Okay, next we're moving up through the hips. Thinking about, again, your lateral hip area. How does that feel? Think about your sit bones on your chair. How does that feel? Can you let everything just sort of soften and melt a little bit? Good. Okay, we're going to move up through our low back now. So feeling the back area. Maybe you're leaning, maybe you have some pressure there on the back of your chair, maybe not. But again, just sort of be aware of your spine in the middle. You've got muscles on either side there. How does that area feel? Just breathing nice and relaxed as we're doing this. Great. Okay, we're going to focus a little bit on the front of our abdominal area. Again, just take some nice, easy breaths. Think about how does this area feel? Maybe think about the lateral aspect of your rib cage here. As you're breathing in and out, as you're inhaling, can you feel your ribs expanding and coming apart? And then as you exhale, can you feel them coming together again. So we'll just take another breath. Again, just as you feel comfortable, these don't have to be big breaths, anything like that. Good. Okay, now we're going to go to the shoulders. Maybe give your shoulders a little bit of a roll. How do your shoulders feel right now? Great job. Okay, now we're going to think about the arms. So going from the shoulders down towards the elbows, just bringing awareness to that area again. Great. Are you in short sleeves like me? Are you wearing long sleeves? Can you feel the material from your shirt against your skin? Just being aware, how does that feel? Next, going past your elbows and into your forearms. Great. Maybe think, does this one left arm feel the same as the right arm? Or do you notice a difference side to side? Again, there's nothing wrong or bad about a difference. We're just bringing awareness to these different parts of our body. Okay, and now we're moving into our wrists and our hands. You can feel free to move your wrists in and out a little bit. Maybe do a few little circles. How does everything feel there? You can spread your fingers apart wide here. You can bring your hands together. Just opening and closing a few times. Again, thinking about all of those fingers. Even if you're resting them on your leg, how do they feel right now? Can you feel your pinky finger? Go through each finger one by one. Ring finger, tallest finger there, pointer finger, and thumb. Great. Okay, we're almost done. We're moving up to the neck now. So we'll just be aware again of your neck area. Think about, you can gently move your chin down to your chest a little bit and look straight ahead. You can look up a little bit if you'd like. Again, all of these movements are optional. Feel free just to sit still and bring awareness to that area as well. We'll turn side to side with your head one way and the other way. Great, okay, so now maybe bring your attention up towards the top of your head. Think about sitting nice and tall. Great, okay, and bringing attention to your face. Do you have any tension that you're holding in your face right now? Just take a nice breath. How does your jaw feel? How do your eyes feel? Great. Okay. Great. Well, hopefully now we've gone through that scan and we're going to be ready to start moving a little bit now. So the first exercise, we're going to start with some different spinal movements. And again, I'll just reiterate to everyone is to check in with yourself as you're going. Remember that number that you gave yourself at the beginning of the class. Now is a good time that we've just done our body scan. Check in with that number. How does it feel? Has it gone down? Has it gone up? And again, just acknowledge that a little bit. Generally, a rule that we use in our GLAD program, I'll share this with you now, is that we generally use the rule that we said we have pain from 0 to 10. If your pain is anywhere from a 0 to 6, we consider that sort of a mild to moderate level, in that it's okay to keep going with what you're doing. If you're feeling like your pain level is increasing and increasing, especially beyond what is a level 6 for you, then it's probably time to just take a step back and check in with yourself, and whether that's taking a break, doing a modified exercise. So again, everyone's level and abilities are going to be different. So again, if you started at a 1 when you arrived today, if you have already moved up to a 5, then we need to check in and we need to adjust a little bit. If you started at a 1 and you're now at a 0 or at a 2, well then that's great, and we're going to keep going. So we're just going to keep revisiting this number as we go through the class here. So with this first exercise, again, we're just going to be breathing normally and relaxed as we do it. I want you to think about slowly, with your hands on your thighs here, rolling down, starting with your chin, bringing your chin towards your chest. And think about moving slow and controlled. As you're going down, feel free to stop whenever you would like. Think of moving segment by segment through your spine, rolling down. Again, whenever you want to stop is fine. And now you're going to come back up again, the same thing. Moving slow and controlled from your lower back, and now your mid back, and then moving through your neck. So you're coming back to standing at the end. I'm sorry, it might have been hard to hear me when I was all hunched over there. So just to reiterate, we're going to do this one more time. So as you're going down, I want you to think about moving sort of slowly, segment by segment, down through your spine. So it's going to be starting at the top of your head and rolling down through your head, through your mid back, through your lower back. Of course, you can stop at any stage, or you can just be visualizing this movement as well. So we'll do this one more time. Again, sitting nice and tall, and then start moving from the back, top of your head, first nods down. The chin is coming towards the chest. You're slowly rolling down through your mid back, lower through your mid back, through your lower back a little bit. And now we're going to slowly come back up. And coming up. And right, finishing with your head coming straight ahead. Great. Okay, maybe just give your shoulders a little roll here. Okay, great job, everyone. We're going to do a little bit of a rotation movement now, side to side. So again, take this as far as you want to, only what feels comfortable for you. And feel free just to watch if you'd like as well, or to visualize. And we're just going to keep breathing normally as we do this. I'm going to get you to reach one hand across to the opposite knee, and then you're going to turn your body to that side. Think about sitting nice and tall as you turn. Just take a nice normal breath here, and then we'll come back to center again. Now we'll go the other side. So bring your hand across, and then think sit nice and tall and turn. Nice slow breath here, and then back to center again. Great, we're going to do that again. So you're reaching across to the opposite knee, sit nice and tall, and then turn. Great, staying nice, slow breath, back to center again. And back to the other side, and turning. Great, and nice slow breath here. And then back to center. Perfect. Okay, we're going to do one more exercise to warm up our spines here. And this is going to be a side flexion. So there's a few options for your arm positions here. You could keep them where you like here on your lap. You could bring them across your chest this way, or you could hold on to the side of your chair as well. So I'll sort of show a little bit. Imagine this one as if your body is between two panes of glass. And so you're just going to lean to the side here as we're doing this. This movement we're not going to hold as much. We're just going to go to the one side and then center and then the other side. And we'll do 3 times to each side. So again, we're going to go nice and slow. Feel free to go at your own pace here. So if your hands are like this, we're going to go leaning to one side, and then you can come back to center, and then going to the other side. Again, paying attention to how does your body feel when you're doing this. You can have your arms this way. We're going to go to the other side, and then back up, and then we're going to go to this side. Perfect, and back up. And we're going to do one more time. I'm just showing a few different options for the arms here. To the one side. Great. And then to the other side there. Perfect. All right. Great job, everyone. Okay. So we're going to go through a little mini circuit, I'm going to call it, where we're going to do 3 different exercises. And we're going to go through each one. That's my 5-year-old, everyone. Just make sure we got that closed. Okay, a little cameo there. So we're going to go through 3 exercises, and we're going to go through this 3 times through. So the first exercise is going to be sitting here. I'm just going to make sure you can see my feet here. And we're going to do heel raises, where, again, think about your foot position on the floor here. You're going to lift up your heels, and then put them back down again. And lifting them up again. We're just gonna do 5 in a row and back down. Great. Number 3, back down. Number 4, and last one. Great. Okay, so that's our first round of those. The next one we're gonna do are gonna be knee extensions. So for this one, it's best to have in your chair so that you're sitting sort of back in your chair so that you can feel the edge of the chair on the backs of your knees here. So for this one, knee extension, we're just gonna think about straightening that knee all the way out or as far as you feel comfortable and then bringing it back down. So again, it's straightening your knee out here and then coming back out again. Here's number 2, perfect. And number 3, remember you can always take a break if you need to. Pay attention to how your breathing is feeling as you're doing this. Great, last one on each side. 4, sorry, number 5. And last one there. Perfect, okay. So that's our round of the knee extensions. So now the third exercise in this series we're gonna do, this is a sit to stand exercise. And again, I'm aware that there's gonna be people of many different levels in this class. So I'm gonna show a few different versions of how to do this. So sort of number 1 version is you're gonna be moving yourself forward so that you're more on the edge of your chair here. And your feet and your knees and your hips are all in a straight line here. So you're doing this. This is a very functional exercise because most of us get in and out of a chair many times throughout the day. And so this is a good exercise to strengthen all these muscles that need to work together in a coordinated manner to make that happen. So again, arm positions, there's a few different options. You can have your arms straight ahead of you. You can have your arms crossed across your chest. If you have armrests on your chair, and if you need to do this, you can do this. I would sort of the main level we're doing, I'm gonna encourage you if you can not to use your arms, but again, you're gonna know yourself best if you are gonna use your arms to get in and out of the chair. So if I'm doing it in this level, I'm gonna lean my body forward. I'm pushing weight through my feet and I'm gonna stand up like this. And then when it's time to sit back down now, I'm gonna slowly go down and my knees are bending, my hips are going back. This is the tricky part. I'm gonna slow and control, go back into the chair. So to show some different levels here, if your chair, if you would like to make this a little bit easier, you can add a cushion, a pillow, a blanket, something to sort of boost up the height of your chair a little bit so that you don't have to go quite so far down. That's a really good option. Another option is to do the whole exercise from a standing, making sure you can see my head here, from a standing position where you're standing and then you're just gonna do as if you were sitting down to the chair, but then you're just gonna come back up. So if I was to show from a sideways position here, it would just be going back and then coming back ahead. So it's just a small knee bend, hips going back and coming back up. Again, arms might be by your side here like this as well. Okay, and again, if none of these options are good options for you, feel free to visualize yourself doing this exercise as well. Or again, you can feel free to use your armrests as well. So we're gonna do 5 repetitions of this exercise now. So we're gonna lean forward a little bit and then stand up. And then we're gonna slow and control. This is the tricky part, is to go down in a controlled manner. So that's 1. Then we're gonna go forward and up. That's 2. And if you look at my knees, I'm trying to watch my knees and make sure they're not coming in here as well. You're trying to keep everything lined up. And then forward, that's number 3. Great. We're gonna do 2 more. 4. Great. Last one. All the way up and then control on the way down. All right, great job. So that is a great exercise where, you know, if you're in your home and said most people are going to be getting in and out of a chair at some point throughout the day, practice thinking about doing that in a purposeful way. Make sure you're not holding tension that's going to be counterproductive to you getting up. Just sit in your chair, or when you're going to get up from your chair, think about that idea of leaning your body forward before you get up, and think about, again, pushing through both feet equally and thinking about that alignment with your hip and your knees. This is a very functional exercise, and this is something that uses a lot of different muscles in your legs to keep them strong and to get them stronger. So this is one of my probably all-time favorite exercises that I spend a lot of time working on with people who have hip and knee osteoarthritis. So we're going to go through that circuit one more time to repeat the exercises we just did. So give yourself a little break. If you know that we've gone through the circuit once and you want to take a breather, you can always join us when we move on to the next set of exercises in a few minutes. So we'll start with the heel raises here. So we're going to do 5 of the heel raises again. So we're going to go lift up the heels and back down, up with the heels and back down. Number 3, down. Number 4, back down. Last one, and back down. All right, great job. We're going to go do the knee extensions now. So remember, for this one, you do want to slide yourself back in your chair a little bit, if that's comfortable for you. And we'll alternate legs again. So we're going to do extend one leg out. You can think about bringing your toes up towards your face if you want, but not necessary. And back down. Then we'll do the other side. Toes up if you'd like, and back down. Number 2. Great. 3. Number 3. Again, pay attention to your breathing. Make sure you're not holding your breath. Here's number 4. Great. Last time. 5. All right. Great job, everyone. Okay, we're going to come back to the squats again, or the sit to stand, also called squats. So again, take it at your own level. If you know one set was enough for you today, then maybe just watch this set. Otherwise, feel free to join me here again, sitting towards the edge of your chair, thinking weight equally in both feet if you can. You can have your arms by your side. You're going to lean forward and then come control on the way up. And then you're going to come back down again, hips back. It's okay for your chest to come forward and control on the way down. We'll do number 2. So lean forward, come back up, and then back down. Looking at your knee position, making sure they're not coming in. Here's number 3. And back down. Great job. Give your shoulders a roll here. We're on to number 4. And back down. And last one. Great job. Okay, we're done that. I'm just going to have a sip of water here. Okay, so moving on now, we're just going to do an upper body exercise next. And this is going to be an arm raising exercise here. I'm just going to move my table a little bit here. Actually, before we do this, let's just take a second to check in with yourself again and revisit that number that we were thinking about at the beginning of class and see how you're feeling. Again, it's not to be judging yourself if it's going up or down. It's just to bring awareness to that and see how you're feeling so you know you can pace yourself appropriately with me today. Okay, so this exercise, we're going to be going, raising our arms out to the side, out to the sort of the corner here, out in like a diagonal direction. So again, think about a cue I like to give people is almost as if you were a puppet and your arms were just being floating up. You can continue going beyond shoulder height if you'd like and go right up to the top if that feels good for you today. And then control them on the way down. That's 2. We're going to do 5 of these. So we'll go back up here. Great. And come back up again. And back down. That's 3. Again, it's totally fine just to go to here. That's 4 and back down. And then we'll do one more. Last one. And then back down again. Great. Okay. Give your arms a little bit of a shake if that feels good. Give your shoulders a little bit of a roll. Perfect. Okay. We're going to do a couple standing exercises now. So again, this is something you could actually do sitting if you want, because we're going to work on some weight shifting side to side and front to back. I'm just going to move back. Hopefully you can see the top of my head here. I'm not cut off. But standing with your feet about shoulder width apart, your arms comfortable by your sides. Again, if it feels better to stay sitting, you can do this in sitting and still think about having weight through your feet that are on the floor. But as you're standing with me here, make sure your knees are not locked. So that means there's a bit of a soft bend to your knees so that they're in a comfortable position here. And again, think about those toes being spread out, maybe give them a little wiggle. Make sure you've got your weight distributed across the whole bottom of your foot, right? From your heel, through the arch of your foot, through the outside part of your foot, and through your toes as well. So you're not having your weight back in your heels. That's something that I see sometimes with patients. You want to make sure you've got weight all the way through the different parts of your foot, especially the front of your foot. Okay, so now as we're standing here, I want you to bring awareness to your right foot. And now we're going to shift our weight gradually towards the right side. So your left foot is going to become lighter as you're doing this. And again, make sure your right knee is not locked. You have a little bit of a bend in that right knee. Good. So again, go to your own level. It might only be a small shift. It might be a bigger shift. It might be to where you're almost going to get to the point where that left foot is just going to float off and then come back down. Now we're going to go to the other side. So now we're going to shift, thinking about the left foot on the ground. The right foot is becoming lighter. Again, stopping wherever you feel comfortable or shifting all the way over, and your right foot may just come off a little bit here and then back down. We'll do one more time each side. So we're going to shift again towards your right. You feel your right leg is becoming grounded. You can feel the weight through your right foot, a soft bend in the right knee. And then your left foot is just going to float up a little bit and then come back down again. Great. We're going to do one more last time on the left. So now we're coming back to the left. The left knee has a soft bend in it. That right foot is becoming lighter. And it may lift off, it may not. And then come back down again. Perfect. Great job, everyone. Okay, we're going to do another similar exercise. This time we're going to stand with our feet 1 foot forward and 1 foot back. So for this one, again, a few different levels here is that if you have a wide base of support, you can see here, I've got a lot of space between my feet this way. That's going to make it a little bit easier versus if you bring your feet as if you were standing on a tightrope. You can either go with your toe to your heel, that's going to be quite challenging, or you might bring 1 foot a little bit further forward. That might be slightly easier, but it's going to be quite a bit more challenging if you're in this tightrope position. So we'll get into this tightrope position. This is a challenging exercise. So the first thing I want you to think about, another option could be, of course, you can bring your chair. You could bring your chair around here and use this for a little bit of support as well. Okay, so now that you're standing in a tightrope, whether it's a tightrope like this or maybe a tightrope with your feet a little bit apart, I'm going to get you to stand in the tightrope position here and pay attention again. How is your weight distributed between your 2 feet? Do you have all the weight on the back foot, or are you getting about 50-50 with both feet? So think about, again, trying to get, most people this will involve bringing more weight into your front foot to try to balance those out a little bit. Great job. And if you feel some little wiggles and some little wobbles in your ankles and in your feet, that is totally normal. That's what we want. That's training your balance, the receptors in your joints that are giving your body feedback about your balance. So you want to be feeling a little bit of wobbles like that. Great. If this is too easy, you can also try closing your eyes, would be another advanced level. Again, totally optional. Great. Okay, take a break for a second here. Let's just go have both our feet side by side. Gives ourselves a little shoulder roll here. And we're gonna do one more time, bringing the other foot in front. So for me, this is my left foot now, coming in front. And my right foot is behind. Again, you can make your tightrope quite narrow, or you might make your tightrope wider. It's up to you. You might notice that one side is easier or harder than the other, and that is very normal as well. So again, when you're in this position now, think about trying to bring equal weight into both feet. So that might involve leaning a little bit forward into that front foot to get more weight there. And just pay attention again, how does it feel? Are you getting some little wobbles here? Make sure your knees are not locked again, so you can have a little bit of a bend in your knees. It's hard to see my knees, I think, there we go, you can see my knees a bit better. They're not straight all the way, they've got a little bit of a bend. Great, if you tried the eyes closed on the first side, maybe try that again here. Okay, great job everyone. Okay, time is racing along here, so we're gonna do one more upper body exercise that you can either do in sitting or standing. I call this exercise a wall push-up exercise. So the action, I'll show sitting actually first here, is you're gonna have your arms out in front, and it's as if you're sort of pushing both arms forward and then bringing both arms back. So you're pushing forward here and back. So this would be the more beginner level to do it this way. I'm going to show a more advanced level, which would be to do it here facing a wall, and to be doing it as if you were doing what we call a wall push-up here. So I'm going to just come this way. I hope my head is not cut off here. Standing nice and tall. So just putting a little bit of weight through your arms. Again, you can modify this. If I come closer to the wall, I could do it this way. And that's going to put less weight. If I decide to step back a little bit further from the wall, that's going to put more weight into my arms. So make sure you choose the level that's best for you, whether it's sitting in the chair or standing at the wall, however far feels good for you today. So in this motion, we're just going to go towards the wall. I'm going to look straight ahead. I know it's hard to hear me probably, but we're going to go bend the elbows towards the wall and then back. Thinking about leading with my forehead when I'm doing this. Great. We're going to do 3 more. And towards the wall. And last one. Perfect. So you'll notice a few of my exercises, like the sit to stand in the chair and the wall push-up here. They involve putting weight through your joints, whether that's the ground or the wall. And we do know that those type of exercises are called closed chain exercises. And those are really good for stimulating bone health, and they're very functional for daily living. Okay, so looking at my list here, we're going to move down to the ground for the last couple of exercises here. So you can feel free again to watch from the chair and visualize the exercises if that's a good option for you today. And maybe again, this is probably one last time to just check in with how your number is feeling that we started with at the beginning of the class. So just check in there and don't judge yourself. Just think of how you're feeling right now compared to when you started. So, all right, I'm going to move down to the floor here. As Jen mentioned at the beginning, if you have a yoga mat, that's great. My cat quite likes using my yoga mat as a scratch pole, so I decided not to use a yoga mat with you today. So we're just going to go onto the ground here. I'm going to make sure, I think you can see me here. Okay, laying on the ground with our knees bent. Just get comfortable for a second. Again, adjust your position a little bit so that your back feels comfortable. You can do a little bit of sort of pelvic tilts here, just to loosen up your back, to changing positions. Again, what feels good for you? Okay, so Another one of my favorite exercises that is a very functional exercise is called a bridging exercise. So for this one, you're simply going to lift up your hips. Again, you may stop here, you might get a little bit higher, or you might go right up to a straight line with your knees between your shoulders and your knees. And then you're going to go back down. So we're not holding it in this exercise, we're going up for 2, and then we're going down for 2. Focus on pushing through, again, the whole bottom of your foot, your heels, your midfoot, your toes, up for 2, down for 2. Great, we'll do 2 more repetitions here. You can also feel the floor through your arms. Make sure you're not holding your breath. Last one. Perfect. All right, great job, everyone. All right, so now that we just did, that is a bridging exercise, is an extension exercise for our back. We're gonna do the opposite motion now, and we're just gonna bring one knee into our chest. Excuse me. We're gonna bring one knee into the chest and just gently give it a little bit of a squeeze. Again, only going to where you feel comfortable today, and then you can put that leg down, and then we can bring the other leg. Great. And then we'll go back down. We'll do one more time each side here. Good. And back down. And then the other side. Okay. Great job. All right. We're just going to do a little bit of side to side motion here with our knees. So you can bring your legs so they're together. So your knees are together here. Again, arms can be by your side. I'm just going to move this chair. I think it's kind of in my way. Okay, there we go. So laying on your back again, and you're just going to control your knees as they go to one side and then come back to center. And then we'll go to the other side. Again, just pay attention to what you're feeling here. Are you feeling your abdominal muscles engaging as you do this? Are you feeling some stretching maybe in your back area? Great. Up again. And then we'll go to the other side. Perfect. We'll do one more time. Great, okay. Perfect, okay. Great job, everyone. I'm just, I think we're gonna stop there. I can't believe how fast that time went by for me. But before I finish here, I just would ask you all again one more time just to check in with how you're feeling. What is that number for you right now? And the rule that we often talk about to our participants in our GLAD exercise program is we'll say to them, you know, how does your number feel over the 24 hours after you finish the class? And that's really important because even if your number did go up a little bit, if you wake up tomorrow morning and you're sort of back to your normal level, then that probably means you did a good job today and maybe you pushed yourself a little more than normal, but you know, you're back to your normal level, so that's a really good sign. So we always tell people to pay attention for about the 24 hours afterwards, and you know, if your number doesn't go back down, then maybe you pushed yourself a little bit too hard, and that next time just to pace yourself a little bit less. And it's all about finding that right balance because you know, I always like to think, you know, movement and exercise really is medicine, and it's not always about pushing through pain. Actually, it's never about pushing through pain. It's really about listening to your body, building an awareness, and being comfortable with what you're doing and building on that, because it might be something that if you follow these guidelines, you'll notice yourself gradually being able to do more and more for that pain level that you're at. So I hope I haven't confused you with that sort of idea that we use in our classes, because I wanted to share it because I know that people in our exercise classes really like that idea, and that it gives them a lot of confidence and a little bit of a guideline of how to know, how much they should be pushing themselves sometimes during exercises. So I think I might wrap up there and say thank you for joining me today. And again, I'm happy to answer questions if there are some questions, but I think I should turn it back over to Jen, and she can let me know.
Thanks, Allison. That was a really nice session. Sorry, I'm not able to start my video. I just need, sorry. There we go. Some technical problems. Okay, there we go. Okay, we do have a couple questions. First of all, can you tell us what is GLAD? What does it stand for?
Yes, I'm happy to. Okay, so GLAD, it stands for Good Life with Osteoarthritis in Denmark. And it's actually, that's why it's called GLAD Canada, because the GLAD part is with Denmark. So what GLAD is, if you look online, if you Google GLAD Canada, you will find the website. So it is a group exercise program that was first developed in Denmark for people with hip and knee osteoarthritis. And so it includes education sessions and supervised exercise sessions. It's 2 education sessions followed by 12 group exercise sessions. It's now available all over the world. Denmark is where it started, but it's in Canada, it's in Australia, it's in China. So if you go to the website, you can find out more information. It is that I teach it at North Shore Sports Medicine. We are actually doing virtual GLAD right now as well. And it's considered group physiotherapy, but there's lots more information, as well as everywhere that is certified to be able to teach the program is available on the GLAD Canada website if you're interested in learning more.
Is there a cost for the programs usually?
Yeah. So there are not in British Columbia, but in Ontario and in a few places it is being publicly funded. In British Columbia right now, it is all it is in private physiotherapy clinics. That being said, because it is a group exercise class, it is much more cost effective than obviously one-on-one physiotherapy. One thing that GLAD Canada is doing is that we are collecting data on people who do the program, basically having people do a couple of quick tests before and having them fill out some questionnaires before and after, because we want to get objective data that shows how well this GLAD program works, because that's how we're going to be able to get money to fund the program, to be able to offer it to everyone, because the idea behind it is it's for anyone with any severity of osteoarthritis, from mild to severe, with the idea that it can hope to prevent or delay needing joint replacement surgery. So that's a little more detail.
Yeah, thank you for that. Okay, we actually have a question about a specific movement. So Ellie's wondering if knees and ankles are stacked above each other in the sit and stand movements. And so maybe you can answer that, but I kind of have a question about, because often we get comments through the classes, and people are quite worried about, how correctly they're doing the movement. Right. And, if things are sort of lining up perfectly, or, all of that sort of thing. So I just kind of wonder if you can, one, if you can answer Ellie's question, but then 2, if you could just address that sort of more broader concern people have about not doing the movement correctly.
For sure. Yeah. So I hear that all the time in my classes as well, just to reiterate, is that, so for Ellie's question, I think, for the sit to stand movement and for the squat, in an ideal situation, we are trying to get alignment where you have your hips stacked over your knees, stacked over your feet, in this sort of straight line as you're coming up and down. So in some cases, in some people, if you do have, for example, some types of osteoarthritis, you will get some deformity in your knee where that is physically not possible to be like that. So we always just get people to do the best they can, obviously, when you're doing that. So the thing is that what happens in a lot of, what happens a lot of times actually is that people are able to do it like this, but if you are weak in your hip muscles, for example, the tendency will be for your knees to collapse in, and you may not really even realize that you're doing that. So that's where that cueing comes in. And if you are at home and practicing, for example, this exercise on your own, ideal situation would be to be in front of a mirror where you can actually watch yourself and watch to make sure that knee doesn't collapse in, because ideally you do want to keep it lined up, and it doesn't have to be perfect, but it's again one of those where we're working on not one specific muscle, we're working on all the muscles working together and making this a functional movement. So the more that you practice it in front of a mirror, doing the best you can, the more likely that's going to carry over into your regular life, so that when you're going upstairs or downstairs, it's also going to be having that as close to ideal alignment as possible. So that is, I think, one of the benefits of the GLAD class is that we have 12 sessions where you're being supervised by a physiotherapist, and that is one of the big things that we find people learn when they think at the beginning they might not have been able to get that alignment, but after a few weeks they are. So it does take some practice, and if you've been used to having your knee sort of collapse in a little bit or move inwards for a long time, it might feel strange to have it all lined up like that. So every little bit is going to help, but I hope that helps clarify a little bit. It's more of being aware of your movement, and again, it might not be possible to have perfect alignment, but you're going to want to be aware of moving towards that alignment in that direction, and it should feel like it'll feel better to move that way as you get stronger and as you get more used to moving that way. So I hope that makes sense. It was kind of a long answer, sorry.
No, thanks for that. And I just kind of want to reassure people, or I want to find out from you if you can reassure people, because in this kind of scenario, you can't see people, you can't really give individual coaching. And I can imagine it might be kind of worrisome for folks that they're doing more damage if they're not doing the movement correctly. And so, what would you say to that kind of a concern in this particular scenario, which, isn't ideal, but is kind of better than nothing, Yeah. Yeah,
so first of all, I think doing these movements in this class and doing the sit to stand, you're not going to be making anything worse as far as like if you had knee or hip osteoarthritis. Doing this amount of exercise, even if you have pain, is not going to progress your disease and make it worse. So I just want to reassure people that there's not always a clear relationship between pain and damage, and so any of the exercises that you're doing in this type of class are certainly not going to be making your joint worse. And yeah, that is one of the challenges with this class, is obviously I cannot see you. So I would encourage you maybe to try, as I said, looking in front of a mirror on your own to try it. But if you're unsure, taking one of the easier progressions, even of, as I said, putting a block under your chair to sort of raise you up a little bit so you're not having to go quite so low, or just even, doing a standing and doing just like a little mini knee bend like this, and just watch yourself and see what's happening with your knees here. And just practice doing it a little bit like this. But yes, I would definitely reassure people that, you're not causing any damage if your knee, is sort of coming inwards a little bit. I'm just encouraging it to move the other way. And that might feel strange for you if it's a movement that you're not used to doing, but you're certainly not going to be causing any damage by doing it.
Okay. Thanks for that. All right. I think we don't have any more questions. I think people have filled out the poll. So I just want to say thanks to everyone for coming today. It was nice to see so many familiar names, and hope you can join us tomorrow with Neil. And thank you, Allison. That was a great session. Thanks for giving us that.
No problem. Thank you.
Take care, everyone.